What if I told you that there is a medication that can reduce the risk of getting HIV about 99% when taken as prescribed? Many people have never heard of it. Others have heard the name but doesn't understand how it works. So today we are talking about PrEP, the HIV prevention drugs that has been changing lives around the world. Who should take it? Does it have side effects? Can anyone use it? And does taking PrEP means you no longer need condoms? Stay with me because I'll be answering all those questions. Hello everyone, welcome back to CarewithJany. And if this is your first time joining this channel, my name is Jane, and on this channel we simplify health topics so that everyone can understand them. If you are passionate about learning more about your health, this page is for you. Don't forget to subscribe to this channel and turn on your notification bell so you can get our newest video. Now, let's get started. PrEP stands for pre-exposure prophylaxis. That is simply a medical term meaning medicine taken before exposure to help prevent HIV infections. PrEP is for those people who do not have HIV but may have the higher chances of being exposed to it. When taken correctly, it can reduce the risk of getting HIV from sex by 99% and from injection drug used by at least 74%. One important thing to remember is this: PrEP prevents HIV. It does not prevent pregnancy. It also does not prevent you from getting other sexually transmitted infections like gonorrhea, chlamydia, or syphilis. That's why condoms are still important. How does PrEP work? Think of PrEP like putting in invisible armor before entering a battle. If HIV enters your body, the medication makes it much harder for the virus to establish an infection. However, PrEP must be taken as prescribed. Missing dose reduces its effectiveness. So consistency is very important. Who should consider PrEP? PrEP may be recommended for people who have a sexual partner living with HIV, who does not yet have a consistently undetachable viral bond, people who sometimes have sex without condoms, people who had a recent sexually transmitted infection, people who have multiple sexual partners and want additional protection, people who inject drugs and share needles and other injecting equipment. Taking PrEP doesn't mean someone is irresponsible. It means they are taking steps to protect their health. Just like wearing a seat belt doesn't mean you are planning for an accident.
Okay.
You are only protecting yourself. Does PrEP have side effects? Just like every other medication, PrEP can have side effects. Some people experience mild nausea, headache, or stomach discomfort during the first few weeks. These usually improve as the body adjusts. Serious side effects are uncommon, but because PrEP can affect kidney functions in some people, healthcare providers usually perform kidney tests before starting it and monitor users during follow-up visits. Always speak with a healthcare provider before starting or stopping PrEP. Can you stop using condom if you are on PrEP? This is one of the biggest myths. The answer is no. PrEP only protects against HIV. It does not protect against other sexually transmitted infections. Condoms help reduce the risk of HIV and other sexually transmitted infections, and they also help prevent pregnancy. Using condoms together with PrEP provides broader protection. Can anyone buy PrEP? PrEP should only be started after an HIV test confirms you are negative. A healthcare provider will also check whether PrEP is appropriate for you and explain how to take it correctly. Regular follow-up appointments and HIV testing are important while using PrEP. PrEP is one of the biggest advances in HIV prevention. When used correctly, it is highly effective in preventing HIV. But it works best as part of overall prevention plan that may include condoms, regular HIV testing, and open conversation with healthcare providers and partners. Knowledge is powerful. The more we understand HIV prevention, the better we protect ourselves and support others without stigma. If you learned something new today, give this video a thumbs up. Subscribe to Care with Jenny for more simple and reliable health education every week. Thank you for watching this video. See you all in my next video.